Hi, everybody, and welcome to the Kidney Coach YouTube channel. I am naturopath Fiona Chin, co-founder of Kidney Coach and Genesis, a range of supplements designed for anyone diagnosed with chronic kidney disease, whether you have a low eGFR or high creatinine levels, or maybe a high anion gap. We might have a supplement for you. I say that because Lindsay and I were talking about anion gaps right before I hit record. And I'm joined again today by the wonderful, the amazing, the beautiful, the very talented Miss Lindsay. I was about to call you Dr. Lindsey Zirker. You can tell I've been doing doctors all week. You equivalent. Miss Lindsey Zirker. She is a renal dietitian. She's part of the team at Kidney Nutritional Institute. She has a huge, amazing background in dialysis and is very competent and confident in all those things. Lindsay is amazing. She works one-on-one with patients now through Kidney Nutritional Institute, helping help people understand the drivers of their chronic kidney disease, why they got it, working with things like nutri-eval tests, genomics, whatever she needs to do, gut stuff, and making sure that people become optimized so they can reverse their chronic kidney disease. Lindsay, welcome back to the podcast.
Thank you.
I feel like I missed a whole pile of things like published author and all sorts of other amazing things that you do. All and a nerdy geek, which is why I love you the most. We like to geek out before we hit record. We were down a rabbit hole before we record on this. So we've been making our way through hormones, and today we're going to do one that actually had far more applications into kidney disease than I was expecting to have. I don't know if you found the same thing. I was like, oh. And that is oxytocin, which most people will know as the love bonding hormone that women produce when they give birth and is stimulated every time they breastfeed. And we want to talk about oxytocin, its role in chronic kidney disease, why chronic stress may deplete your oxytocin levels and then maybe make things worse. And a whole pile of other amazing things that oxytocin does. So, Lindsay, I'm going to hand it over to you. Let's start high level. Tell me all high level things. What do people need to understand and know about the hormone oxytocin?
Yes, so it is a peptide hormone that is produced in the hypothalamus, and it is released from the posterior pituitary gland. And like you said, it is kind of like the love hormone, bonding hormone. But interestingly, oxytocin's impact on the person will vary quite widely depending on their environment, the relationship, of what they're experiencing, their gender, and of course, individual neurobiology. So what's going on in their brain, actually. So like you said, it is a social bonding and kind of attachment hormone. So it's super important for the mother and infant for bonding, and it enhances trust and social recognition, but only in like a general group or in perceived like safe people. So it's not going to like brainwash you, so to speak. Because on the reverse side of things, stress, anxiety, and emotion regulation, it can definitely help with that because it can help reduce cortisol output, but only if you're in a safe environment. If you're in an unsafe or stressful environment, oxytocin can actually amplify anxiety and defensive behaviors. So I totally didn't realize that about oxytocin. So that was interesting.
Yeah, I found it interesting too when I was down my side quest of Zelda
Yeah.
rabbit hole, all of this, that if children, especially boys, were abandoned or didn't have enough love from the mother, their oxytocin receptors completely shut down. And so when they're given oxytocin from a partner, this is apparently what causes this whole avoidant attachment partnerships. They don't have the oxytocin receptors, so they don't actually know how to form bonds. So fascinating. Anyway, that was my side quest thing that I went down yesterday.
Well, I mean, that makes sense because looking at oxytocin in different types of health conditions outside of kidney disease, they're looking into that for autism spectrum disorders, which I feel like totally makes sense. Um, but, with the stress and anxiety, chronic pain, postpartum, those ones are kind of obvious, but yeah, that makes sense.
Yeah. So let's not do kidney disease yet. What, apart from the bonding stuff, what other physiological effects does oxytocin have on the body, both positive and negative? You mentioned a bit about anxiety being a negative one, but what are these physiological responses or processes that oxytocin can knock onto?
So it primarily works in the brain. So I feel like that's also why the person's individual neurobiology will really shift how oxytocin impacts somebody. Um, because so it's a hormone, but it's also a neuromodulator, like how it can affect other hormones. Um, so we have receptors in the amygdala, the nucleus accumbens, which I did not learn that in anat and phys. I may have forgotten a lot, but I'm pretty sure I never knew that one. And the hippocampus.
Yeah.
And these are the primary spots for emotion, bonding, reward, and threat perception. Um, it also helps enhance your sensitivity to social cues, whether it's good or bad. So it kind of helps you read the room a little better with what's going on. Um, and as far as what it, excuse me, um, what it does, one of the things that I thought was important when I was like looking at stuff, and it's just like clarifying that oxytocin doesn't create love. It's not a love potion,
Good
but
to
it will
say.
amplify connections that already exist. And so I think that's kind of helpful because I do feel like hormones are so powerful um, that sometimes we feel like we are totally not in control, which, it really does feel that way sometimes. And so it can feel a little bit kind of uh, weird to be like, this hormone could make me like feel more bonded to people. Like, what kind of control do I have? Like, it could make people feel unsure, but it's like, no. Um, if it's, if there's already a connection there, it'll amplify it. But if not, then, it's not gonna do things. Um, so I thought that was an important differentiation. But other things that it does, so what we may be kind of more familiar with is that uh, in labor and lactation, definitely some clear roles there because it causes the uterine contractions to initiate labor. Um, and it triggers the milk letdown, not milk production specifically. Um, and also, it is involved with sexual function and intimacy. Um, and interestingly, it also has some different metabolic effects where it can decrease your appetite and also increase fat oxidation. So that could help with weight loss and improved lipid profile, and also helps with your energy balance. So it plays a role with how your body's like achieving homeostasis, specifically looking at appetite and metabolism there. And of course, there's always some rando link to bone stuff, it feels like. I'm like, how is bone like so randomly involved with everything? But they did find that some studies showed that lower oxytocin levels had impaired bone structure, which also makes me think that somewhere we have to have vitamin D involved. I did not necessarily come across that, but it's got to be in there somewhere.
Yeah.
Um, but then also it helps with sleep. It can help induce relaxation and tranquility to help promote sleep. So those are some of the other things that it does. Any other
And so,
things?
yeah, it was, what did I find? It was antioxidant and anti-inflammatory, so it worked on some of those
Oh yeah.
pathways,
Hmm.
which were obviously important for kidney disease, which we'll get to. And
Hmm.
then the thing I said I found out about it that I didn't know. They're the big ones. Oh, and then it helped with fibrosis, but we'll talk about that when we get to
Hmm.
the kidney specific stuff because it works on the immune sort of pathways with cytokines, and it has an effect on the gut, which I also found really interesting as well. So before we get into the kidney stuff, I want to know a few things. One, how do we create oxytocin in the body? Are there things that we can do, like food, like people want to know if there's foods or anything that can stimulate it, or actions and things that we can do apart from just being pregnant and giving birth? And so there's that. And then you can buy, I mean, I'm obviously deep into the peptide rabbit hole. You can buy oxytocin as a nasal spray. People use it. Why
Mhm.
people might be putting that into their peptide stacks and what they might be using it for as an endogenous process. And then let's get into all things kidney disease.
Yeah. All right. So things that can increase oxytocin. So to the question about food, there isn't really specific foods that I know of that like
No.
increase it, but an anti-inflammatory and gut-friendly diet, they kind of indirectly support oxytocin pathways, specifically because of the vagus nerve and the gut microbiome. Um, which I guess it shouldn't be any surprise also that the vagus nerve is involved when there's so much of it that is like for oxytocin to really like do its thing, you have to be in a safe environment. And the vagus nerve is going to help the brain recognize that. But other things that increase oxytocin are physical touch, like hugs, massage, affectionate contact, sexual intimacy, positive social interactions, laughing, breastfeeding. That's kind of weird because it's not like, oh, that's how I'm going to raise my oxytocin levels. But breastfeeding does do that. So just know, I think that is some of the benefits with breastfeeding is that you do get the increased oxytocin levels.
Yeah.
Um, Warmth, specifically looking at your skin temperature, will increase oxytocin. Meditation, breath work, that can increase those levels. Eye contact, which again, when you think about the mother-baby bonding, it is that eye contact that helps with that. Supportive, positive relationship, and interestingly, rhythmic experiences like music, chanting, and dance, which I was super curious about that. Didn't have time to explore that rabbit hole, but I will later. Um,
Interesting. I know for me, because I'm a deep meditator, I know how to actually release oxytocin. I know exactly what it feels like, but definitely listening to music I love, I get the same sensation that I get in meditation, which is an oxytocin release. So it makes sense to me. Can't tell you the mechanism, but yes.
sure.
I mean,
Yeah. Yeah. So, I mean, and I think that is partly why music has such a powerful draw. It made me think too, like one of the classic like teenager things is they get way more into music. And I'm
mhm.
like, well, that totally makes sense when all of their hormones and everything is in upheaval during puberty. And like having music that, resonates with them is going to be, helping them feel safe and calm. So. I
Yeah,
was like,
definitely.
okay. Things that can decrease or dysregulate oxytocin. Big shocker here. Chronic stress and elevated cortisol. Dude, that stuff just ruins everything.
It
It's
really does.
like, the cockroach that is just hard to get rid of. Um, Different types of trauma, like attachment trauma, childhood trauma, those kind of things. Um, Depression, social isolation. Inflammation, and low estrogen. So, kind of thinking back to our estrogen
Mm.
podcast, oxytocin responsiveness declines after menopause.
I
Because,
wonder if that's linked into your bone density thing, whether that whole mechanism works together, just as a side thought. But man,
yeah, that makes sense.
mm,
Yeah.
we'll have to go down
Hmm.
that hole at some time. And so,
Yeah.
I'll let you keep going before I ask you why people might take, or what would be the, you know, precursor for people to want to take it endogenously.
No, I think that's most of the things, unless there's anything you had to add.
Nope, you covered most of it. I know, and I do know men and women like oxytocin stimulated differently for men and women. That was the rabbit, like I
Hmm.
said, rabbit hole I ended up down when I was looking into it. But
Do you want
apart
to
from that,
speak to that a little bit?
uh, More in the things that I came across was that the male bonding hormone was more likely to be vasopressin, so VIP versus oxytocin. Men will still get oxytocin stimulated, and what was interesting is there's a bigger oxytocin release if a man puts his head on a female's chest, if we're talking about those kind of
Hmm.
hetero relationships, but versus a woman putting her head on a man's chest. If a man puts his head on a female's chest, it stimulates all that back part neurological memory of being breastfed and all of those kind of things. But yeah, if you want to get your man to stimulate his oxytocin, he needs to put his head either in your lap or on your chest, those kind of things versus around the other way. And then vasopressin, which we will maybe, if you're up for it, cover in the next one, was more the how men
Sure.
bond through vasopressin and how it works through those pathways, but different topic.
Perfect. I feel like that's an important thing because again, I mean, that's one of the things that, the impact and stimulation of it is going to be different, like we said, based on environment and sex and
Yeah.
neurobiology and all that.
Yeah, it is quite a different response in men and women. My understanding is women have a higher receptor site load for oxytocin than men do, and then men that system's more regulated via VIP versus vasopressin versus oxytocin. So yeah,
Yeah, which does kind of make sense. I mean, like you were talking about before we got on, it really makes you think about the psychology differences with men and women. With men, women always like wanting to gather and they tend to use more words and like more connections and need their girlfriends and all that kind of thing. Whereas men, it's different. Like they need to go
yeah,
and be accomplishing something.
yeah, which
So
is VIP. Yeah, and exactly that's exactly what I was looking at yesterday, and
yeah,
that's exactly right. That's all of that stuff.
yeah.
It's fascinating.
So as far as like supplementing with oxytocin, or the intranasal oxytocin, most of the stuff that I saw it used in outside of like studies and stuff was for off-label use, was for mental health conditions, like for social anxiety, PTSD, but also sometimes for sexual dysfunction. Um, those kind of things can be potentially helpful for people. Um, Definitely, commonly used with labor and childbirth, those kind of ones
Yes.
more common. But they're looking at clinical trials for obesity, and also where um, I'm just like, it was like where stress reducing effects are really key. And I was like, so like everything, but it was like specifically talking about chronic ulcers because
Right.
those are
Yeah.
pretty focused with stress, but also looking at it for addiction. Um, so yeah, it's kind of interesting things that it's, being used for. That's what I kind of came up with. Um, any other things in your experience you've
No,
seen
you
before?
mentioned it previously, which was sleep for some people that
Mm,
will that sort of stuff. But yeah,
yeah.
and when people want to chill out, so people that just have that inability to get into that
Mm,
super relaxed I call it the post meditation kind of bliss
mm,
sort of state. I do know people in the biohacking world that use it to induce that, which is an offset to stress. High exec, I know my high execs often will use it on weekends just to offset that go, 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 biohacker stacks. They might be using like Benagine or like SS31 nasally or MOTS or I don't know, Celanc or CMAX, whatever they're using for that hyper focus during the week. And then on the weekends, they might switch to an oxytocin just to, you know, chillax and do other bits of the brain and things like that. So that's how some of the biohackers might use it.
yeah. And I feel like a lot of the research is like still fairly like preliminary on some of these other things. And I would really love to see like I mean you couldn't do blind studies exactly, but like thinking about, the various different ways to increase oxytocin, like is that, as effective as getting a hug or massage however many times a day or a week. Um, it'd be really interesting to see the comparison with
Yeah.
those. I mean, it
And
could be
look,
different for everyone. Some people don't like
yeah.
getting touched.
And look, I think if anyone's listening, I think if you want to upregulate your own receptors and get greater receptor density and things like that, I think doing it through all this, like, so good social bonds
Yeah.
and safe environments and meditation are really good. It might be if someone has PTSD or severe abandonment attachment styles because of a really traumatic early childhood where they actually have a
Sure.
massive downregulation in receptor sites, that
Hmm.
endogenous nasal sprayed oxytocin along with that might be a really nice way to safely, with probably with a therapist on board, to make sure that they are
Yeah.
tagged safe environments if that's something they've not their mirror neurons haven't learned as a child, to get that going.
Hmm.
That might be a really nice way to better build your capacity for good healthy social bonds in healthy relationships and not moving into an avoidant attachment style. That might be a way to biohack that, for want of a better word, or to improve that sort of pathway. I can imagine it probably would be. It's not something I have a heap of experience in, but
Hmm.
apart, I would think, and I agree with you, studies would be great on that. I wonder if just doing it socially in the way it's meant to be done has a better way of building up your receptor sites and just better forming healthy attachments and knowing how to navigate the world. So, yeah.
Yeah.
So, kidney disease. Why do we
Yeah.
care about oxytocin if I had CKD?
Yes. So, most of the research that I looked at was either from small human studies or animal models, but what they were finding, excuse me, is that in kidney disease, especially in more advanced stages, later stages, that it does seem to alter the signaling in the hypothalamus and the pituitary. And so that's not just oxytocin, that's going to be multiple things, like thyroid, which we've talked about. So yeah, it's kind of it gets to be, as we've talked about before, kind of a weird soup of things because things just kind of go off the rails. Um, but also inflammation, metabolic acidosis, increased cortisol. These are all common things that happen in kidney disease. Those reduce oxytocin release from the hypothalamus. Um, and then there's some evidence that the uremic toxins, they decrease the oxytocin receptor expression in some tissues. So I feel like that's a pretty common thing. Like the more that I'm looking into it, that, that's one of the reasons why kidney disease is like it just messes up everything, is that those toxins just downregulate receptors for everything.
Yeah.
So your body's just like, well, thanks. Now my hands are really tied. So, um, so yeah, there's reduced signaling or reduced receptor availability. In dialysis, they found in some of these smaller studies that there is a lower baseline oxytocin that, again, they're still kind of exploring all the things, but it does make you think about the chronic systemic inflammation, autonomic dysfunction, the altered neuroendocrine regulation that kind of goes along with all these things. So it's kind of still preliminary, but it makes sense based on what we know.
Yeah, it really does. And then I saw that study, I think it was done in a mouse study on the fibrosis in, I think it was acute kidney
Yeah.
injury, about, and you made a really interesting comment about whether acute and the chronic stress, like the trauma that goes with an acute kidney injury and the downregulation of oxytocin. That was such an interesting comment that you made. So I'll let you speak to that.
Yeah, so looking at how does oxytocin impact kidney function, it definitely has, some direct kidney effects. It's a mild diuretic, and impacts especially the sodium handling. It in some of the studies, but apparently not all, it helped increase kidney blood flow to the kidneys. Um, and then, as you kind of mentioned already, it does influence vasopressin pathways. They are apparently structurally similar peptides. So there's a little more crossover than we might expect.
Mm.
Um, yeah, I saw a study where specifically looking at ischemic kidney injury, so any kind of kidney injury that has caused lack of oxygen to the kidney or caused kidney damage, that oxytocin helps with that. And so it made me think about acute kidney injuries, especially where it was like maybe more traumatic. The the stress that goes along with that, it made me wonder if, people in that situation, they have a reduced chance of kidney recovery or more fibrosis in there than someone else with, a less kind of traumatic situation. Um, so yeah, I don't know.
Wow,
But
right. Interesting
I mean,
hypothesis.
yeah, I mean, you just gotta kind of think about, there's plenty of times when no one can explain what's going on in people's kidneys. So I think it's good to cast a wide net. Um, but like you mentioned before, oxytocin also has those anti-inflammatory and antioxidant effects, specifically helping to reduce tumor necrosis factor alpha. Interleukin 6 helps modulate NF-kappa beta and helps improve endothelial function, which is one of our favorite things
Mhm.
because kidney is such a vascular tissue. We want that to be good. Um, so yeah, in animals who had acute kidney injuries, they gave them oxytocin, and it helped reduce fibrosis and oxidative stress. So that's promising, but again, animal study.
Yeah.
Um, but we take those promising things where we can get them.
Yeah, exactly.
So
Yeah, so the same stuff. Interesting. So it's definitely not one because it's, on face value, you go oxytocin, kidney disease, which is what I did. I'm like, there won't be much here. And then I was like,
that's what I thought too.
I got that one wrong. Didn't realize, so it has a much bigger
Mhm.
implication than we think. And I definitely, chronic disease can be a very isolating,
Yes.
stressful thing to go through, right? And you think about what happens when you feel isolated from your community because you've got a chronic disease. And you and I understand this a little bit from having autoimmune diseases and
Mhm.
you have to rest more and go internal and disconnect. It is part of managing the effects of chronic disease. So you remove yourself from those potentially social bonds as a mechanism of self-preservation, that would downregulate your oxytocin levels. So, and then you think about all its, antioxidant and anti-inflammatory effects, and then you think kidney disease, and if you're having dialysis, however many times a week, if you're doing that solo, sometimes it's great you're in with a whole pile of other people and you have your own community there, so that might be not what's happening. But if you're doing like home by yourself, or you've been removed from that sort of stuff, or you feel like you're isolated because no one understands, then that is going to downregulate your oxytocin levels and
Mhm.
potentially drive that or cause some dysregulation or diminish some of the amazing effects that oxytocin has, which is those anti-inflammatory, anti-fibrotic, antioxidant
Mhm.
effects. So yeah, it definitely plays a bigger role than I thought. And it also it brings that point back to how important it is if you have a chronic disease, that good social bonds and community and having that support around you is, you and I spoke about it before, you and I both like this, fiercely independent people. So when something happens with our health, and I know you broke your ankle there or leg, and then you were like, oh my goodness, people have to come and help me do stuff. And I hate that. But,
Yeah.
that probably, that whole community and support probably actually helps with healing. So I think it's really important.
Yeah.
I think it's quite natural to want to isolate, but I think, having really good community around you is really important as a part of healing due to the properties of oxytocin. So, yeah.
Yeah, I feel like it gives like a little bit more, I don't know, like tangible reason of why community and relationships are so healthy. Well, some of them are not, but why they can be so healthy for us for our mental and physical health. Like you don't have to know about oxytocin to know that you feel good when you get a hug from someone you love, you know. And so I feel like it's kind of nice when like we know these things and then they're validated in other ways or it's clarified. Yeah, this is why that feels that way. And I I do think that as looking back at healthcare and, these pioneers of people who they're trying to figure out what's going on with people and how they recognize that sunshine and fresh air and positive relationships and being in a environment that is clean and aesthetically pleasing, these are just as important for healing and health as medications or diet or exercise. Like, you
Totally.
can't heal without you know, all these things together being added in, really.
No, I totally agree. It's fascinating. And, the other thing that I think of is the biggest factor they found in people that had long lives with good health span was connection and community. And you go,
Hmm.
that's oxytocin regulation. I don't know the correlation. I haven't seen any studies where people have correlated oxytocin levels with longevity, but we do know the biggest impact on long, good quality health of life is community. So I go, that's fascinating because that's an oxytocin driven environment.
Hmm.
So I
Yeah.
suspect it has a really quite a big protective role all over the place in maybe its anti-inflammatory and antioxidant role, but maybe more than we realize, whether it's oxytocin or not, but it would make sense that it is because that is the hormone of bonding and good social networks and things like that. So I find that really fascinating as well, that we might be missing some of the bigger things that oxytocin does.
Hmm. We're not like optimizing it. Because like you said, with chronic disease, it does make it really easy to isolate. Like
Yeah,
there's a lot
absolutely.
of barriers there. And sometimes, it can be challenging to have, these kind of positive relationships when you have people in your life that really aren't that positive, and setting boundaries is difficult and all those kind of things. But I think, we all know that when we have those healthy relationships, like they're rewarding on so many levels that it's worth kind of working through those barriers and setting those boundaries so you can have that.
Yeah, totally agree. Fascinating. Well, oxytocin, you outdid my expectations. I love that. Anything else
Yeah.
you want to add about our friend oxytocin before we wrap this one up?
Well, I mean, I was just thinking because like this time of year is, more holidays and people spending more time with friends and family, but also there's all those kind of weird stresses that come up for a variety of reasons, like trying to pack too much stuff in or crazy expectations and those kind of things. So I think that and there's that whole other layer on top of it with kidney disease because it's like, well, all of these gatherings include food, and can that even work for me? And it adds a whole other layer. And it's something I've been talking with a lot of my clients about because here in the US, we have Thanksgiving next week, kicking off our season. I mean, let's be honest, I did already start listening to Christmas music, but um, I think that um, there's definitely a few things that I feel like are pretty key to kind of help people, during the holidays, during busy times, so that you can get that oxytocin boost, which, is probably somehow, in the grand design to have more of these holidays and oxytocin boosts during the winter when you need a little bit more. That I think there's things that people with kidney disease can do so they can enjoy the holidays. So I thought maybe we could talk about some of those things briefly, since,
Yes.
there's not like any, food information we can give them on this one. But I feel like planning ahead is such an important thing. I actually tell my patients the 4 P's of navigating the holidays. The first one is planning ahead. The second one is finding ways to participate. The third is balancing people versus personal time. And the last one is being patient with yourself. Um, and that kind of thinking through those things of, okay, we have this party coming up or this family gathering coming up. And you know, maybe it's short enough that you don't even have to worry about food. You eat before and then you just go and you bring a craft or a game or something to do that allows you to participate and, you know, uh,
Mm.
enjoy your friends or your family or balancing that people versus personal time. Like if, this is a really challenging time of year or any time when things get busy, taking the time for, self-care in your personal time, and then you have that mental and emotional bandwidth to really enjoy the people time. And then being patient with yourself as you navigate those things because, yeah, it's probably going to look a little different every year. So you might think you have figured it out, and then guess what? You didn't really. So you got to figure it out again for this year. I think that those are things that can be really helpful. They aren't really food focused, but just keeping those things in mind so that holidays can be more fun and you can get your oxytocin boost with all your friends and family.
Love that. What good advice. Amazing, Lindsay. Any final words of wisdom on top of that? Although I feel like they were very good words of wisdom.
Yeah, I think that that's a good thing to keep in mind. And um, yeah, I think something we learned from this is that the body is awesome
Mhm.
and that, we always think of oxytocin as for like pregnancy and labor and baby bonding, but as important as that is, it actually does a lot of other cool stuff, which is how everything else is in the body. So
Yeah.
there's always more to
Amazing,
learn.
everybody. Well, I appreciate that. If anyone out there would like a fabulous practitioner who probably will actually spike some oxytocin because she genuinely cares about you, then I'll put Lindsay's details below. Actually, that's a good important point. Make sure you're working with practitioners where you feel that, like, we talk about this all the time. So I
Mhm.
think that's important. But anyway, I'll put in kidneynutritionalinstitute.org below, and then you can find Lindsay and Jessiana and the team there. If you have any questions or any particular hormones you want us to look at, have a look through our playlist. We've done heaps, but if there's ones we've missed that you'd like us to do, put it in the list below. I think I'm going to make Lindsay tackle vasopressin next, so stay tuned. Make sure you hit subscribe and like. That way you'll get notified when that new podcast comes up. And if you want to know more about what we do, head to www.kidneycoach.com and you'll find us on social media under the same things. All right, Lindsay, as always, a joy, a pleasure. Thank you for your time, your wisdom, and your knowledge. And I look forward to seeing you next time. And everyone who's part of our community, thank you so much. We're sending you big love and a big warm oxytocin hug. Thank you. Bye.
Bye.